Madam Speaker.
The honourable member for Vancouver Kingsway.
Madam Speaker, Canada failed to protect long-term care residents from the first wave of the COVID-19 pandemic. More than 840 outbreaks were reported in long-term care facilities and retirement homes across Canada, accounting for more than 80% of all COVID-19 deaths in the country. This represents the worst record of all comparable countries. The situation was so dire that Canadian forces had to be called in to long-term care facilities in Quebec and Ontario. Residents there were found underfed, abandoned, and afraid. In some cases, they had been left to die alone in bed, covered in their own urine and feces. These stories shocked our conscience and challenged our self-image as a compassionate and humane society. However, they were entirely foreseeable and avoidable. Experts and advocates have been raising an alarm over the state of Canada's long-term care sector for many years, but successive federal governments have failed to act. Indeed, decades of research have demonstrated that insufficient staff-to-resident ratios and a reliance on precarious working conditions have led to hurried, dehumanizing care, high staff turnover, and workforce instability in the Canadian long-term care sector. British Columbia's long-term care system entered the pandemic with several advantages because the NDP provincial government had made progress on these issues prior to the outbreak, despite the void of federal leadership. This included implementing measures to promote better coordination between long-term care, public health, and hospitals, increased funding for long-term care, fewer shared rooms, and more comprehensive inspections. Moreover, Premier Horgan acted early in the pandemic to limit long-term care workers to a single facility to prevent the spread of COVID-19. Before the pandemic, workers were forced to pick up shifts at multiple facilities which paid differing and insufficient wages. However, the BC government has spent more than $10 million a month to level up the wages and benefits of long-term care workers so that they earn a standard income no matter where they work. Premier Horgan has pledged to make this increase permanent. Madam Speaker, as Canada sits on the crest of a second wave of COVID-19 and outbreaks in long-term care facilities are flaring up once again, residents remain at extreme risk due to continued federal inaction. In order to prevent another catastrophe, Canada's leading scientists and scholars are calling on this government to act immediately to implement binding national standards of care tied to new federal funding. In its recent throne speech, this government did pledge to, quote, work with the provinces and territories to set new national standards for long-term care, unquote. Yet, it failed to provide a timeline for action or a commitment to new federal funding. Can this Liberal government confirm whether binding national standards and funding tied to meeting these standards for long-term care will be in place in time to protect vulnerable residents from the second wave of COVID-19?
The Honourable Parliamentary Secretary to the Minister of Seniors.
The Honourable Parliamentary Secretary, we can't hear your mic.
Hear me now? Okay, I would like to say thanks to my colleague from Vancouver Kingsway for his excellent question.
One of the biggest tragedies of this pandemic has been the loss of life in long-term care homes. Like all Canadians, we're alarmed by the events that took place. In a country such as ours, we shouldn't need to send in the army to take care of our seniors, as mentioned by my colleague. The pandemic laid bare issues that the long-term care sector has faced for many years, and it also highlighted the essential work that personnel and caregivers are doing across the country and their contribution to our society. While long-term care is regulated by provincial and territorial governments, the federal government cooperates with them to ensure the security of residents and of personnel. The new financing of COVID-19 resilience will go towards infrastructure and to modernize long-term care homes, making them more resilient to ensure the safety of seniors. The Safe Restart program invested over $500 million in infection control in long-term care homes and other vulnerable populations. We set out guidelines for long-term care homes to prevent and control COVID-19 infections. We're investing billions in protection equipment and PPE for healthcare workers, including those in long-term care homes. We've provided $3 billion to provinces and territories to increase the salaries of essential workers who earn low wages, such as those in long-term care homes. Members of the Canadian Armed Forces were deployed in more than 50 long-term care homes in Quebec and in Ontario, as mentioned by my colleague. In the speech from the throne, the government presented an ambitious plan to collaborate with other levels of government to help to improve the way our society takes care of seniors in long-term care homes. Our government will commit to working with provinces and territories to establish new national standards for long-term care, but our government will elaborate sanctions as well in the criminal code for those who neglect seniors they take care of, endangering their lives. We're also going to establish other measures to support orderlies and other care personnel. All of these measures will contribute to help better protect seniors and prevent this type of tragedy from occurring again in the future. In conclusion, Madam Speaker, seniors built our country and continue to provide a precious contribution to our society and to our communities. Seniors have to know that they can always count on our government to meet their needs, and we're going to be working hard for them. Thank you very much, Madam Speaker.
The honourable member for Vancouver Kingsway.
Madam Speaker, families